That's good. Since when did you start this nursing career of yours?
So I started my career as a nurse in 2015. I was just graduated from the college and I became a nurse for the surgical ICU.
Nice.
I started, but I really wanted to go to OR, like operation room, because when I was in the military service, I was a combat medic, but I used to work in like Marine Corps, but I moved to Naval Hospital. At the time, I was working as a like OR nurse assistant or something. So I really loved that job, and I really wanted to become an OR nurse, but I couldn't because there's no OR nurse positions were occupied, so I couldn't go. I couldn't get a job there.
Yeah.
So I became an ICU nurse instead of becoming an OR nurse.
Okay. Did you ever try to become an OR nurse afterwards?
Afterwards, I really love like ICU.
Oh.
So I never wanted to go back.
Oh, yeah?
Because I think ICU is the best job for the nurses.
Oh, really?
And then we always call that like ICU nurse is the kind of representative of the hospital because we know a lot of expertise and we do a lot of things at the hospital. We are always we are frontline workers, so we always do something and then notify doctors, and then doctors came later. So that's why we are really proud of our job because we have to do it really fast.
Nice. What's ICU nurse in Korean?
중환자실 간호사.
중환자실
간호사. 네.
What would you say was the toughest part, or what is still to this day the toughest part of you working as an ICU nurse?
The toughest part in the ICU would be like maybe there's a lot of patients and we have to take care of all at once. It means that certain hospital they have like certain ratio for the patient and nurse ratio, but our hospital have like high ratio. It means that one nurse have to take care of a lot of nurses.
Wow.
So sometimes it's really challenging because I'm not a person of like capable of multitasking. So sometimes it's really hard for me to focus on like many things all at once because I have like 5-6 patients at the same time. But I used to work at a really big hospital. At the time, I had only one patient, so I can focus on one patient only. But the condition, my patient at the time had like deadly condition or their conditions were critical. So I have to take care of them really seriously and then do something all the time. But right now, their condition is not really serious, but in the meantime, I have to take care of a lot of things. Like I have to call the doctor when they have symptoms, and then I have to get double check the prescriptions, but I have to double check like 6 patients at the same time. So it's really hard.
Right.
Sometimes I miss that, or sometimes I have to deal with some problems, but at the time I was so busy doing something, so I could not neglect, but sometimes I kind of make mistake for that.
Right. Would you say this has worsened since the doctor strike?
Of course, because these days our ICUs are packed all the time. Because before doctor strike, it wasn't really that packed.
It wasn't as bad.
Yeah, this is really kind of worse right now because a lot of university hospital they said that we cannot take this patient.
Right.
So they have to get the ambulance and try to go somewhere
whichever hospital can accept them. Right.
So they ended up coming here, and we have certain like doctors who can do the surgeries or who can do some procedures. So that's why a lot of patients will come to our hospital to get the treatment. But sometimes it's like beyond our service. It means that we don't really have some doctors for the certain like department, like how can I say? Maybe, for example, we don't have heart surgeon. So when certain patients have like heart problem, they cannot come here, but they don't have hospital to go, so they have to come here. But they somehow go to certain hospital for that, but sometimes they need certain like high level procedure, but they couldn't find the hospital, and then they have to come to my hospital. So that's a really hard, and that's really sad because people have to find hospital because a lot of hospitals say no. And then my brother is a EMT, and he always said that some hospitals they're not gonna allow patient to come because they always say, oh, we don't have this doctor, we don't have that doctor, so we can't really accept the patient even though they are really sick.
Right. So what we see on the media with regards to doctor strike is that the government wants to increase the number of medical students to become doctors, right? And what you just talked about is because there are lack of doctors, because doctors are protesting, that is kind of exacerbating the whole situation, making everything worse. Doctors are not coming into the hospital to work because they're protesting. So do you kind of resent doctors right now? Like, are you angry that the doctors are not working because of this? Or do you have a different opinion about this?
I kind of disappointed with doctors because I thought they like also hypocrite.
Oh, okay.
In Korea, becoming a doctor, it means that you can make money and you can have, but all of a sudden they don't want to take care of patients because of the like abrupt situations where the government tried to like increase the number of the doctors.
Right.
But I kind of think that I understand their resentment because right now the government should change the system of the medical like insurance because the fee itself is too low for the doctors. That's why a lot of vital department like heart surgeons like or general surgery or like gynecologists like or pediatric doctors, those are jobs which that cannot make a lot of money. So that's why a lot of people don't want to do it. And in the meantime, it's really hard because those patients are really sick, and then they have to be taken care of all the time. So doctors should get the call all the time, and they sacrifice their time, and they have to stay at the hospital, and whenever they get the call, they have to come to hospital ASAP. But they don't make a lot of money. That's why they don't really want to. A lot of like medical students, they really don't want to become like those vital department doctors. So that's a really big problem. And the government right now is kind of, from my perspective, for them it's easy to just increase the number of the doctors instead of the fixing all the medical system, the medical insurance system, because a lot of people think that our medical insurance system is really good because it's really cheap and it has great access to clinics or hospital whenever they like. But because of that, it's really cheap and it's really easy to go.
Right. So for the public, it's easy because there's great access to healthcare, cost is cheap.
Yeah.
But for the doctors who have a lot of work to do, especially in the vital departments like you mentioned, gynecology, cardiology, or whatever departments you just mentioned, pediatrics and stuff like that, because for the amount that they get paid, the workload is too much.
And then,
so you're saying the doctors want a change in how health insurance works, but the government is not really responding to that or are reactive to that. Instead, they just want to increase the enrollment of the medical students.
Our system itself is kind of eccentric. I mean, it's really weird because if you look at a hospital in maybe Harvard University Hospital, maybe the Boston, the General Hospital in Boston, and then the Tokyo University Hospital, they don't really have a lot of residents. But in Korea, I see the article 47% of the residents, they a lot of big hospitals, they really count on a number of residents because they're cheap, and they don't really quit because they need that training. So that's why a lot of residents, they're really, really upset about it, upset about the increased number of the medical students, because they think that if that happened, they think that their position, maybe they don't really get guarantee that they can make a lot of money, or because if government try to increase the number of the medical students like that, 2,000 people, it means that there's every year 2,000 doctors. In 4 years, 8,000 doctors. It's kind of crazy. And then the quality of the doctors will be kind of really low, because these days I personally think that doctors are really smart, and then because their system itself is really competitive. If you don't pass a lot of exams, you can't really graduate. So that's why a lot of doctors' level is kind of the same. But if they're 2,000 doctors all at once, I don't think they're not as smart as the doctors right now. And then the quality of the service will be so low, and then it causes another problems.
Right. So yeah, competition usually creates an environment where the best ones come out on top. And so that makes sure that the doctors are of top quality. So that's your perspective.
That's my perspective, because I understand their resentment, doctors' resentment, and at the same time, just government, they try to kind of manipulate doctors' opinions, because by just increasing the number of the medical students, 2,000, that's kind of nonsense, because the university, medical school, they don't really have that kind of system, because they cannot handle with that kind of numbers, because these days the doctors' numbers, the student numbers, kind of limited. But once the government try to increase the number of it, they need time for the number of the classrooms, and they don't really have the practice, clinical observation or practice, because a lot of doctors, a lot of students all at once, they don't really have that capacity to teach them, because right now it's really small, but all at once they increase 2,000.
You're saying there are not enough senior doctors to kind of teach
them
and train them,
and then they don't really have that kind of classroom.
Okay.
They need time for the.
So in a way, what the government is doing sounds a little selfish.
Really selfish, and they don't really take care of citizens in Korea, because it's been almost maybe more than 5 months or 6 months. I'm not really sure, but since then I have witnessed that a lot of people have to get certain like treatment, but they cannot get it, and then they waste their time. Some people die because of that.
Exactly.
So I was really sad.
It's a critical issue. I've heard enough stories of patients going from hospital to hospital looking for a doctor to treat them, but the hospital is already packed with other patients, or like you said, they don't have a specialized surgeon working at the time. So, unfortunate stories have been popping up on news feeds.
All right.
All right. Well, thank you for sharing your time.
Thank you.
Hopefully you get the visa soon.
Yeah.
To work in the States.
Yeah.
Yeah.
I really want to go.
Good luck in your future endeavors, man.
Thank you. It's hard. I'm not really sure what I'm saying.